Idiopathic pulmonary fibrosis, or IPF, is a disease of scarring in the lungs. And it's called idiopathic because we don't fully understand how it occurs or what are the processes that accelerate it or slow it down. And for a long time, there hasn't been any effective treatment from a medical standpoint. People with IPF usually present with an abnormal x-ray, or they may come in with cough or more shortness of breath. And they usually have a CT that shows some degree of scarring in their lungs. Patients may have what we call hypoxemia, and that just means low oxygen levels in the blood, and that is treated with supplemental oxygen. And the goal is to maintain an acceptable oxygen level in your blood when you're sitting at rest, but also with activity. So in general, most people will benefit to a certain degree from pulmonary rehabilitation. And so the idea is to get the most out of the lungs that you have. One of the problems with chronic lung disease is that people become progressively more debilitated because they simply sit around because they get short of breath. And so just even that anticipation of exercise is a big barrier to actually participating in any sort of activity. There are several medical therapies that have been used in the past with different levels of success. So some patients may end up on a small amount of steroids. Other patients are treated with N-acetylcysteine or Mucomyst, which is an antioxidant therapy. So recently, in late 2014, the FDA approved 2 new drug therapies specifically for treatment of IPF. The 2 drugs are pirfenidone, or Esbriet, and nintedanib, or Ofev. And both of these drugs are designed to slow down the rate at which lung function is lost due to scarring. So the exciting thing about these 2 new drugs is that for the first time we have a medical therapy that slows down the rate at which pulmonary fibrosis progresses. However, they don't reverse the fibrosis that's already occurred. And in some patients, if their disease is advanced or progressive despite medical therapy, then lung transplantation may be an option. Lung transplant is really a life-changing event for patients because they are now completely dependent on medications to prevent rejection, and they can be more susceptible to infection because of these anti-rejection medications. So long-term, those 2 complications, rejection and infection, are what we struggle with. We usually follow patients very closely, especially within that first year after transplantation, because that's where a lot of the complications tend to arise. And so this, from a patient's perspective, they can expect frequent visits at the clinic, frequent monitoring of their lung function and lab tests, and also a very intensive pulmonary rehab program that's designed to help them recover from the transplant and get back on their feet.